How's it going? It's Lawrence Performance Ranch, and today we're going to go over some thoracic rotation. There's one thing we see a lot of our clients when they walk in our doors, they limit the rotation from the thoracic spine, meaning this upper part of their back. Multiple reasons why, right? A lot of it's lifestyle related, a lot of it's just our sports that we play or whatever we do. You know, we have this forward posture that we're always trying to help and correct. So I'm gonna have Eric here kind of go through some range. I'm just gonna do a little assessment real quick. I'm gonna have you hold this across your chest, just like this. Good, and I just want you to rotate, and I just wanna see how far you can go. I'm just basically gonna use this as a marker to checkpoint each direction. So I'm gonna go to the left. Good, so I have him about here. Good, going to right. Good. So he has a little more rotation to that right side. You play golf? Yeah, and are you right-handed? Yeah. Makes sense. So you can see he has that backswing, right? Definitely limitations to the left side. So we're gonna do a simple little exercise you can do at home. I prefer to do this. You can either sit backwards in a chair or you can sit on a bench, whatever. I'm actually gonna get his legs a little bit wider by giving him assistance. You're gonna put this between your knee, to the knee and the bench, and this one between the knee and the bench. It's gonna give it a little squeeze. And what this helps do, it helps lock down the lumbar spine. So now he's not gonna move from here. All the movement's gonna come from his thoracic spine, the upper back. So go ahead and Eric, put the hands behind your back. Behind your neck. Good, now just take a nice deep breath. And we're gonna rotate to the left as far as you can. Once you can't go anymore, you're gonna stop, and I want you to bend, laterally bend into it. Take a real deep breath in through your nose, and then out through your mouth, and as you breathe out, you wanna try to drop into a little bit more. There you go. You're not necessarily leaning, you're just driving it down. There you go, now do it again. We'll do that 3 times. 3 deep breaths. No, I'm sorry, we're going to stay there. Take a deep breath, and then every breath out, try to drop in a little bit more. Good. And this is his first time ever doing this, so we're trying to really work from the ground up here. Good. Come back up, upright. You're gonna rotate even more to the left. There you go, and do the same thing again. So deep breathe out as you rotate into it. As you bend into it. Real deep breath, in through the nose, out through the mouth. As you breathe out, really try to get that lateral bend, lateral flexion there. Then we're gonna do it one more time. We're gonna do 3 breaths, and we'll do 3 rotations. So we're gonna come back up, gain a little more range now. Come to the left, there you go. Same thing now, drive it down, drive that elbow, breathe, breathe. Good, you may feel some cramping going on. Some of the muscles there, they haven't been in that position in a while. Good, so now you're gonna stay with that same rotation, but you're gonna do the same, you're gonna bend to your right side now. So same rotation, now just bend to your right side. There we go. And just focus on that breathing in, breathing out, really drive that thoracic spine here. Good, come back up. Now we'll do the same exact thing. I want you to, let's just do a little check real quick, just for fun. Go ahead and rotate to the left as far as you can. Good, you can see how much range you got now. Go ahead and rotate to your right now. Good, they're about almost the same now. So now we're actually gonna gain a little bit more from the right because he was restricted. Now, did you feel the difference there? Yeah. Yeah, so go ahead and go to the right now and do the same exact thing to the right. So laterally flex into it, bend. Basically what you're trying to do here is you're really trying to breathe in from this left lung here because you're closed off on the right lung because that's what this is doing, right? So you're really expanding through here. Good, come back up, rotate further to the right. Same thing again. So drive it down, focus on that breath. Good, in through the nose, out through the mouth. Again, we put the hands behind the back because we're really trying to work on posture, try to get upright and tall rather than it being rounded forward because we're trying to get the spine into its ideal position. Okay, one more time to the right. Focus on driving down and breathe. Good. And then now once you're done with this, you're gonna do the same flexion pattern, but to the left now. So keep your rotation where it's at. And now you're gonna bend to the left. There you go. Focus on that breath. Good, get that rotation. Good. And now, when you're done, gonna sit all the way up. And just real quick, keep the hands behind the back. Let's go ahead and rotate to both sides, kind of see how you feel. There we go, other side. Good. Let's go ahead and put this across your chest and just see if you feel the difference there. So again, I don't have an exact marker, but you can definitely tell there's a lot more range. How does that feel? Oh, yeah. Yeah, go the right now. Good. So we even got a lot more to the right, which is fine. His left will catch up. It just takes time. Of course, this is his first time ever doing this. So now we got the rotation going. So it's one thing to get it. Now we got to keep it. So the way we're going to keep it is we're going to work on some strength, some patterns in that same position. Sorry, some pulling patterns in the same position.
Okay.
All right. So we're going to go ahead and go to that now. All right, Eric, so now the strengthening pattern we're gonna go to is just a half kneeling row with a little rotation, okay? And the reason why I put you in a half kneeling position, just like I had you sit here, is we're gonna block off your lumbar spine. So we're not gonna let your lumbar move around. I'm gonna have you concentrate on focusing on your hips being level. You're gonna allow this band to pull you forward. Let me get back a little bit. You're gonna allow the band to pull you into rotation, not forward, but actually rotate you. So I'm getting pulled forward, my thoracic's getting rotated, my hips are level, and all I'm gonna do is engage my shoulder and pull and finish. And I'm actually gonna do that again, but I'm gonna keep my arm away from me a little bit. So you see my elbow doesn't go too close. I'm just working on this rotation. I'm getting my core to work, I'm getting my scapula to work. So again, it's the same pattern we just did, except we're adding some strength to it. All right? So let's just do about 5 each side. Get you on the right side first. Again, go ahead and put your left foot in front of you a little bit more. Good. Now I want you to get your hip down a little bit. So now it's level. There you go. Now you're level. So allow this to pull you forward. Good. So now you're concentrating on that core. Now before you bend your elbow, pull your shoulder back, squeeze the shoulder blade together, and then finish the rotation. There we go. Let's try it again, but try not to move from your pelvis, from your hips. Same thing. There you go. Concentrate on staying strong through the ground. Relax that shoulder. A little bit more, relax. Woo, there you go. So again, as you do this, you want to really try to stay soft up in the trap. So the way you can do that, you can have a friend or even yourself go and reach to that left shoulder. Feel this thing stay soft. Let's go ahead and get it soft. That's where it needs to stay. Now try that same thing. Good. And the reason why we do that, we're not trying to get his upper trap involved in this, we're just trying to get the lat involved in this and all these posterior chain muscles here. Good. One more time. Pull. How does that feel?
I can feel it.
You feeling the lat? Do you feel, how about here? You feel the core working at all? A little bit?
Like on this side.
Perfect, good. Go into the same exact thing on the other side. Just do five reps. Again, ideally, you'll probably do this for homework. Do the thoracic rotations, about 3 to each side, takes about 2 minutes. Then you come and finish up with this, about 10 reps each side. And that's pretty much it. That's a lot of the rehab or kind of corrective work that we do for thoracic rotation. Good, of course there's so many more things we could do for it, but these are very simple and very easy. There you go. And again, I'm just guiding him through the range with my hands. I'm keeping an eye on his hips, making sure those aren't moving. Good, and his shoulders staying soft. You feeling down in here, the lat? Good. How about through the core, the front side?
Yeah.
Good. Let's try that one more time. Let's get this hand a little wider. Just a tad wider as far as over here. Then you go ahead and pull. As you pull back, there you go. I'm trying to keep his elbow away from his ribs. Good. Let's try that again. Now you kind of feel what we're looking for there. There you go. That's it right there.
Yeah.
Perfect.
Okay.
Good. So overall, again, the whole goal was, so the goal of the whole exercise, the whole drill that we did with the seated rotation, and then again, doing the actual seated or the half kneeling row, is just to gain mobility first, because that's what we did here. But in order to hold on to the mobility, you got to add some strength into it. So we're teaching him how to hold his core, hold his posture upright. We're telling him, teaching him how to actually use his lat to do the row rather than using the traps to do the row. So all those patterns, ideally done repetitively, a couple times every week if you're having issues with thoracic spine. That's going to ultimately lead you to feeling a lot better, a lot taller. I just know from experience, I was just telling a story that I hadn't played golf in 6 months, and I went and shot at Top Golf on Sunday, and I've really been doing this as my homework. This has been my main thing I've been doing the last couple of months now, because I've been having some issues with my neck and my thoracic spine. So when I added this in, I also added a little bit of strength work in. Well, my golf game was back to even better than it's ever been. And I was completely surprised. I was like, what is different? And I realized, oh, I actually have thoracic range of motion. So if you're a golfer, if you're somebody that does rotational sports and you're lacking that thoracic range, meaning you're able to get through this position here, maybe your coach is always telling you, your friends are telling you, oh, you just don't have that range and you're trying to get it from your lower back. Well, if you go into an exercise like this, you're gonna get range, you're gonna hold on to it, and you're gonna feel so much better playing whatever sport you enjoy playing, golf, swimming, whatever the rotational sport is, even just life in general. Being able to stand up tall is a big, big thing. So try it out. Again, just a few times every week is all I really recommend doing. Give yourself about 5 minutes to finish these two exercises, and you're gonna feel a lot better.